Hello everyone, welcome to this video on chronic stable angina. In my previous video, we actually learnt about pathogenesis of chronic stable angina, investigations, and what are the main symptoms of chronic stable angina. In this video, we will learn about stress testing. So, an important pathogenesis of stable angina is you will be able to see ischemic changes only when the patient is exercising, not during rest. So you will have to make the patient exercise and then see if there are any ischemic changes. So this is very important. Like baseline ECG will not be of so much use in stable angina. You will always have to make patient exercise or undergo some stress to see if there is any impairment in blood supply and demand. Okay, you can get stress ECG done, you can get stress echo done, or you can get radionuclide scans done. In this video, I'll be telling in detail about stress ECG, or which you call as treadmill test. This is very commonly done test. You should know the practical aspects of this because you will be getting doubts from your relatives, doubts from your friends. Okay, so let's start with this video. The first thing is, for any stress ECG, there are few contraindications. You cannot directly tell patient to get treadmill test done. So you will have to see if there are any contraindications. If there are no contraindications, only then you can ask the patient to proceed with treadmill test. So the first thing is, always get stress resting ECG and echo done. Okay. Resting ECG and echo done, and look for contraindications. So what are the contraindications of treadmill test or stress ECG? If there is any rest angina within 48 hours, you will not get TMT done. Or if there is aortic stenosis, or if there is aortic dissection, endocarditis, myocarditis, pulmonary infarction, pulmonary embolism, severe left heart failure, or any unstable rhythm. These are the contraindications of TMT. And in echo, you can check for global and regional wall abnormalities. You can also assess LV function. Okay. First step is get resting ECG done and echo done. See if there are any contraindications. If there are no contraindications, only then proceed for the treadmill test. So if you see this image, here is a patient, and to this patient the physician is attaching ECG monitors and BP. He is monitoring BP and ECG of this patient. Commonly used protocol is what we call as Bruce protocol. So what do you do in this protocol? You will make the patient to walk on the treadmill with certain speed and certain gradient. When the patient is walking, you will record the heart rate of the patient, blood pressure, and see if there are any ischemic changes in the ECG. That is the main part. So in Bruce protocol, you will start at the speed will be 1.7 miles per hour at 10% gradient. Now imagine if the patient is like the patient in this image. The patient is very elderly. So in that case, the patient won't be able to start directly at 10% gradient. In that case, you will start at 1.7 miles per hour speed and 0 gradient. This is called as modified Bruce protocol. So Bruce protocol was 1.7 miles per hour at 10% gradient. Whereas if the patient is elderly or unable to exercise a lot, then you can start at modified Bruce protocol 1.7 miles per hour at 0 gradient. Normally what happens when the patient is exercising, there will be gradual increase in the heart rate and gradual increase in blood pressure. You will be monitoring for these things. If the patient is unable to exercise, if the patient is having some myopathies or neuropathies, then you can use pharmacological stressors like adenosine and dobutamide. Instead of making the patient exercise, you can use these stressors and see if there is any ischemic changes. Now, when do you stop? You looked for any contraindications. There was no contraindication. Then you started the patient with modified. Imagine modified Bruce protocol. You started at 1.7 miles per hour at zero gradient. After 3 minutes, you will go on increasing the speed and you will also increase the gradient. Now, when do you stop? You will stop when there is drop in systolic blood pressure. If there is drop of 10 millimeter mercury of blood pressure, you will stop it. Then instead of gradual increase in blood pressure, if there is severe increase in blood pressure, if there is severe hypertension, even then you will stop. So systolic more than 250 mm mercury and diastolic more than 115. If you will be monitoring ECG as well. If you find any arrhythmias or if you find any bundle branch blocks, even then you will stop the exercise. Then very important thing is, if you find any ST depression of more than 2 mm, ST elevation more than 1 mm, but this is very dangerous. So ST elevation means the patient is going into STEMI. So the main thing that you will see is ST depression more than 2 mm. ST elevation more than 1 mm, you will immediately stop. If the patient is having angina, if the patient is having dizziness or syncope, if the patient is having signs of hypoperfusion like pallor, cyanosis, even then you will stop. If the patient is having diaphoresis. And finally, if the patient himself or herself is saying, I'm unable to do, even then you will have to stop this test. There are multiple stages of Bruce protocol, and all stages, like nobody, only like very trained athletes can pass all the stages. Otherwise, nobody will be able to pass these stages. So, average healthy human being, the person will be able to do at least 2.5 miles per hour at 12% gradient for 3 minutes. Okay, so if there are any of the symptoms, you will immediately stop. But if the patient is not having any of these features, you can continue the exercise. Healthy patient, like only very healthy athletes will be able to cross all the stages of Bruce protocol. Otherwise, they will at least be able to do 2.5 miles per hour at 12% gradient for 3 minutes. What is the importance of stress ECG? There are two important things that you can find out with stress ECG. One, if the patient is having angina or not. Second, if the patient is having angina, at what metabolic equivalence the patient is having angina. You can calculate metabolic equivalence. So now what is metabolic equivalent? Metabolic equivalent is the resting volume of oxygen required by 70 kg 40-year-old male patient. Okay, there is a human being who is 70 kg and 40-year-old. When that person is resting, what is the volume of oxygen required per minute? That is the metabolic equivalent. So one metabolic equivalent is 3.5 ml per minute per kg body weight. Once imagine there's a person and you perform treadmill test on this patient, you understood that the metabolic equivalent after which the patient is developing angina is 5 metabolic equivalents. Like after that, the patient is having chest pain. In that case, you can actually advise patient what activities can be done, what activities cannot be done. Take example of 5 minutes. Okay, now 5 minutes. If you see this chart, what are the what are the activities that are requiring less than 5 minutes? So cleaning windows, raking, bed making, stocking shelves, light welding, dancing off. So you can tell that patient you can do dancing, you can do walking, golf, you can play tennis, but if you start playing singles tennis, or if you start playing basketball, if you start doing snow skiing and all, you will suffer angina. So you can educate patient what activities will cause him angina, what activities can be safely performed with the use of metabolic equivalents. Also, if the patient is performing any activity which is more than his capacity of metabolic equivalence, you can tell that before, if this activity is necessary, then just take nitrates before doing this activity to prevent angina. Is this clear? This is the importance of stress ECG. Now this is one ECG with positive TMT. If you say this, so can you see there is ST depression here, ST depression here, and V1, V2, V3, V4. As soon as you find this finding, and if you see this, which is this is stage 1 of Bruce protocol. So the patient is walking at 1.7 miles per hour at 10% gradient for 3 minutes. After that, the patient is having ST depression in the ECG. So this is a positive TMT test. You should immediately stop, and if you have any of these findings, you will send the patient for coronary angiogram. Is this clear? We are done with stress ECG. Now another thing, which is a newer topic, coronary artery calcium. What is the final step of atherosclerosis? It's deposition of calcium. Now if you can calculate how much calcium is deposited in coronary arteries, you can actually identify if the patient is at risk of developing atherosclerotic cardiovascular disease or not. So coronary artery calcium, CT scan is performed. CT scan, then they calculate how much calcium is deposited in coronary arteries. They'll see number of deposits, they'll see area and density of calcium deposits. The scoring used here is Agatston scoring, and depending on the score, you can actually tell if the patient is at risk of developing atherosclerotic cardiovascular disease or not. So normally if the score is Agatston score is between 1 to 10, you will say it as minimal risk. If it is between 10 to 100, mild. If it is 100 to 400, then it's moderate. If the score is more than 400, then the risk is high. So this is one of the newer concept. You can actually this is non-invasive as well. So you can actually suggest your relatives, if they're comfortable with CT scan, well, you can actually suggest your relatives to get calcium scores done. Apart from that, stress imaging. So you will infuse some radionuclide elements into the body and ask the patient to exercise. You will see if there is any impairment in the perfusion during exercise in the coronary vessels, or in the ventricles, or in the heart muscles. So what all you can use for radionuclide scans? You can use 99M technetium, then 201 thallium, and you can also get PET scan done using N13 ammonia and rubidium 82. So this is about investigations. I would say this video is very, very important for practical aspects, right? You should be able to suggest your friends or your relatives what are the tests, like you randomly, because now epidemiology of ischemic heart disease has changed. Patients, like very young patients, they are also getting chest pain, angina, MI. So your friends or your relatives might ask, I want to know if I have risk of developing heart attack or not, what all things I should get it done. Or they might ask you, no, TMT, my doctor has advised TMT, what should I do? What are the basic investigations before I should get it done before TMT? Should be able to, you should be able to answer all these things. That's it about this video. I hope this is very, very clear. Let me just quickly recap. So commonly, like the main investigation required for chronic stable angina is stress testing. Before getting stress ECG done, get baseline ECG and echo done. Look if there are any contraindications. If there are no contraindications, proceed with stress ECG. So Bruce protocol, modified Bruce protocol are the commonly used protocols, and you will look for gradual increase in blood pressure, heart rate. You will continue if there is any problem, like if there is ST elevation or ST depression or drop in blood pressure or severe hypertension, angina, syncope, pallor, diaphoresis. If any of these things are there, you will immediately stop this test, send the patient for coronary angiogram. If there is no any of these changes, then the patient will be at least able to walk 2.5 miles per hour at 12% gradient. After this, you will be able to identify if the patient has angina, and also you will be able to calculate the metabolic equivalence. After calculating metabolic equivalence, you will be able to educate the patient what activities will cause angina, what activities will not cause angina, and before which activity the patient has to take nitrates. Then ST depression. Apart from that, coronary artery calcium, this is a very new concept and very interesting concept. Agatston scoring is used. Apart from that, you can also use stress imaging, 99M technetium, 201 thallium, N13 ammonia, or rubidium 82. That's it from my side. Thank you.